Right now, somewhere in the world, someone is swallowing a tablet. That tiny pill is about to begin one of the most complex journeys in biology, surviving stomach acid, crossing cell walls, hunting down a single target deep in your body. This is pharmacology, and after this video, you will never see a medicine the same way again.
Pharmacology comes from two Greek words, pharmakon, meaning drug, and logos, meaning study. But the real definition is simpler. It's the science of how drugs interact with living systems. Every drug you'll ever study follows a four-step journey. We call it ADME, absorption, distribution, metabolism, and excretion. This is the map we follow today.
Before a drug can do anything, it has to get in. The path it takes is called the route of administration. Oral is the most common, pop a tablet and wait. But oral means delays, stomach acid, and liver interference. Intravenous is the fastest, straight into the vein, 100% reaches the blood, 0 waiting, but it's irreversible. Sublingual, under the tongue, is the clever middle ground. Blood vessels under your tongue absorb the drug in minutes, bypassing the liver entirely. That's why nitroglycerin for heart attacks goes under the tongue, not in the stomach.
Absorption is not guaranteed. When a drug is swallowed, it faces a gauntlet: stomach acid, enzyme attack, and the first pass effect. Imagine 100 molecules entering your gut. Only 40 survive the liver and reach your bloodstream in active form. That surviving fraction is called bioavailability. The higher it is, the more efficient the drug. Lipid-soluble drugs cross membranes like butter through warm toast, effortlessly. Water-soluble drugs need protein carriers, and if the liver destroys too much on the first pass, the drug simply won't work orally.
Once in the blood, the drug doesn't stay there. It spreads, but not evenly. Some drugs love fat tissue and disappear into it. Others cling to plasma proteins like albumin and stay in the blood. Only the free, unbound drug can act. Think of protein-bound drug as parked cars, unavailable, but they'll enter circulation once the free drug is used up. And the blood-brain barrier? It's the most selective checkpoint in the body. Only lipid-soluble drugs get past it. That's why designing drugs for brain disorders is one of the hardest problems in medicine.
The liver is the body's drug processing plant. It takes foreign molecules and transforms them, chemically altering drugs so they can be eliminated. This happens in two phases. Phase 1, the liver modifies the drug. Oxidation, reduction, hydrolysis, think of it as unwrapping the drug. Phase 2, it attaches a large molecule to that unwrapped drug, conjugation, making it water-soluble and ready to leave the body. Remember, Phase 1 modifies, Phase 2 conjugates. And here's the clinical twist. Some drugs enter as inactive prodrugs, and Phase 1 actually activates them. Codeine becomes morphine in the liver.
The kidney is the final checkpoint. Drugs and their metabolites are filtered, and what the body doesn't need, out it goes in urine. Some leave via bile, some through the lungs. That's how a breathalyzer detects alcohol. Now, pharmacodynamics. How does the drug actually produce an effect? Most drugs work like keys in locks. Receptors are the locks, proteins on cells waiting to be activated. Agonists are keys that fit and turn. They activate. Antagonists fit but don't turn. They block. Beta blockers block adrenaline's receptor on the heart. The heart slows, blood pressure drops. That one receptor interaction, that's pharmacology in action.